Well, greetings again. This is Dr. Bill Wyatt with the American Orthodontic Society, and I want to show the other type of treating cysts. In this cyst was removed what we just call the fast way. I sent this young lady, had the whole side of her jaw was a cyst here, and we sent her in for an oral surgeon. And I'm going to just run through what took place and what I think. I've lost some of the x-rays on this, but I think one of the molar teeth was removed also. So let's get with it. This won't take but just a little while to do this video. So let's get, let me get some little pointer here and draw this stuff. And this is the young lady that had the cyst, and this is on the side of the jaw. The cyst was way out in here. It will show the x-ray here in just a minute. And hardly see the difference in the size of the face at all, but it's this side that has the cyst in it right there. Now we'll go ahead, and here the dental pictures just shot in her mouth. I didn't show any of the orthodontics finishing the case up. I should have done that, but this is where the cyst was over on this side of the face. You'll be able to see it from the large picture that we'll show here in a minute. And the other side of the mouth was relatively normal. Now when we look at this, this shows it on the other side, but actually we're looking at it from the back side. This is the cystic tissue down in here. Now you look at it from another view, and the cyst involved way down in this area of the mouth, going on up, and these are the teeth up above, and this is going to be the gory surgery now. If you don't want to look at the blood, look the other way. But that's a hole where the cyst was. And there, here is a picture, another picture of the cyst itself. This doesn't look like it goes with that deal. All right, anyway, they injected, let me go back here and see. That's shooting through the side. That's where the cyst is. Now when he went in to take this cyst out, he injected her first and pulled some liquid out of the cyst. And this is what was in the cyst, the liquid there. Okay, here is the area. So the oral surgeon made an incision that fits out like that. And now he cuts this bone away from up here. And if I remember correctly, one of the molar teeth went with the cyst. Now he takes that tissue out of there. You can see the bone here is removed in this area, and he takes this out. Now there it is, kind of cleaned up a little bit, so you can see where the bone was taken away here. And now he'll take his tissue and lay it back over that and sew it together again, and you're through with the cyst. So that tissue was sent to the lab, and it's epithelial tissue, and so it's not a cancer or anything else like that. It's just a cyst that's been peeled out of the body. Now if you remember correctly, we said if you go in and make a hole in this area and put gauze and keep it open and take the pressure out over a period of time. You have to keep packing it, put this gauze in this hole, bones over it, and just let the pressure off, and that bone shrinks back up again, and the teeth come back in their position, kind of the way we showed the slow treatment of the cyst. And I know this is the way they treat the cyst all the time, but this is a way an old surgeon immediately goes in, makes a cut there, peels the cyst out, gets everything else, closes it back up, and he's through with it. So if you want to do it the fast way, this is it, and the other way we open it up. And I told you in the other deal, I had a policeman in Africa that had one about the size of a hen egg in the very same place, and we cut a hole in there and put this gauze in it, and we worked with him for a few months there, well, a month or two, keeping that drain open, and this thing just shrunk right up to nothing. And so that's the fast and the slow different way to treat the cyst. And to me, the slow way is the very best. And the guy said was opening under the chin, and the whole jaw was a cyst. I've never seen that, and probably you'll never see that again. Looked in, and the teeth were hanging down like these stalactites in a cave. And if you had kept that open for maybe months, you know, that would have shrunk up again, and maybe they saved the teeth and the jaw. So I don't know, the guy just disappeared, and I never saw him again. So there's no telling what happened to him. He may have had a place that just drained and it stayed open. If it stayed open, the cyst would reduce in size. That might be what happened. Hopefully it was. So I'll say goodbye. Let me get over here and close this out. And this was the epithelial tissue, and that is the cyst just taken out by itself. And there's the slab, the lab, and this is the epithelial tissue, not like that. That's just a close-up of it. So this is all we have on this particular case, but I wanted to show it in conjunction with the other slow treatment that we had, and you saw how that little girl thing turned out. So thank you for watching, and I hope you'll join our group and subscribe to our channels. Thank you now, and I'm going to say goodbye, and you visit us again. Thank you.